Hello, everyone. Let's explore the futuristic voice hub for healthcare, the real time clinical command center for the AI first hospital. Imagine calling your hospital and never waiting on hold. Imagine a nurse, a care coordinator, and a documentation assistant all showing up instantly in one voice experience without adding headcount. Imagine every conversation turning into structured clinical data, safer triage, faster scheduling, and cleaner billing workflows in real time. That is the promise of a futuristic voice hub for healthcare, not a voice bot, not an IVR replacement, a platform that becomes the operating system for patient communication. Now let us define what we mean by a voice hub. A voice hub is a centralized real-time voice intelligence layer that connects patients, clinicians, and administrative systems through secure, governed, low-latency conversations. It is the front door, the switchboard, and the automation fabric for healthcare communication. And here is the key shift. In healthcare, voice is not only convenience, voice is access, voice is trust, voice is equity. Voice is often the only interface that works consistently for older adults, for low digital literacy populations, for rural communities with unreliable broadband, and for patients who are stressed, sick, or overwhelmed. At the same time, healthcare has a structural problem. Communication demand is exploding while human capacity is constrained. This creates gaps in preventive care, chronic monitoring, follow ups, and care navigation. Voice based AI agents are increasingly seen as a scalable way to fill those gaps, especially when human intervention is not economically feasible for every interaction. So, the futuristic Voice Hub is not just a customer service upgrade, it is a system level strategy to expand the reach of care teams. Why is this becoming possible now and not 5 years ago? The answer is real time generative voice agents, powered by large language models that can understand and produce natural speech dynamically instead of following rigid pre coded flows. That matters in healthcare because real healthcare conversations do not follow clean scripts. Patients interrupt themselves, they forget details, they contradict earlier statements, they share emotional signals, they use informal language for symptoms, they code switch between languages. A next generation voice agent can ask clarifying questions, adapt to the patient's language and health literacy, and integrate prior context when it is allowed to do so. But to deploy this safely, we need a platform architecture, not a collection of bots. The futuristic Voice Hub is a healthcare command center that does five things at once. It automates high volume administrative interactions like scheduling, billing, and insurance questions. It supports clinical workflows like symptom intake, medication adherence check ins, and care navigation with strict risk controls. It creates real time operational intelligence for call centers and care teams. It generates structured documentation that flows into clinical systems. And it enforces governance, privacy, and safety at every step. Now let us build the architecture. Start with the entry layer. The Voice Hub sits behind your phone numbers, your patient access lines, and your outbound calling infrastructure. It integrates with SIP telephony, contact center platforms, and WebRTC for browser based calls. It supports inbound calls, outbound outreach, and internal clinician workflows. Next is the real time audio pipeline. This includes noise suppression, echo cancellation, and streaming transport so speech can be processed incrementally. Real time systems must avoid waiting for full utterances. They need streaming speech recognitions, streaming reasoning, and streaming speech synthesis so the conversation feels natural. Low latency is not a nice to have, it is the user experience. Healthcare calls are emotional and time sensitive. Awkward pauses reduce trust. This is why modern end to end voice pipelines use concurrent execution. Speech recognition, language model generation, and speech synthesis can operate in parallel rather than sequentially to reduce end to end delay. Telecom research on low latency voice agents shows how streaming ASR, quantized LLMs, and real time TTS can be integrated in a concurrent pipeline to keep responsiveness high. Now move to the speech recognition layer. In healthcare, accuracy is safety. The system must correctly capture medication names, appointment dates, insurance IDs, and symptom descriptions. When uncertainty rises, the system must ask for confirmation or escalate. Next is the clinical conversation engine. This is not just intent detection, it is orchestration. The Voice Hub needs a policy governed reasoning layer that decides what the agent is allowed to do and what it must not do. Here is the futuristic pattern. The language model is not the brain that runs everything freely. It is a controlled reasoning component inside a governance shell. It can only use approved tools, approved workflows, and approved knowledge sources. It must log every action. It must follow risk tiering rules. Now add retrieval augmented generation. Healthcare knowledge changes constantly. Policies, benefit rules, clinic protocols, patient education materials, and operational procedures evolve. A safe voice hub should ground its responses in approved internal content and clinical pathways rather than improvising. Then comes the integration layer. The voice hub becomes an integration fabric to core healthcare systems, scheduling platforms, patient portals, billing systems, claims and eligibility checks, nurse triage workflows, care management systems, and when appropriate, electronic health records. Finally, there is the data layer. Every conversation produces structured artifacts, transcripts, summaries, disposition codes, escalation reasons, follow up tasks, quality flags, safety events. These artifacts feed analytics and continuous improvement while respecting retention and privacy policies. Now, let us discuss the heart of the futuristic vision. A major insight from healthcare voice agent research is that these systems can become a practical extension of the care team if they are designed responsibly, validated rigorously, and deployed with clear escalation pathways. Think of the Voice Hub as a layered workforce. At the base layer, it handles low risk administrative tasks, scheduling, rescheduling, reminders, billing questions, insurance verification, directions, clinic hours, and basic navigation. At the next layer, it supports moderate risk activities, preventive outreach, screening reminders, chronic disease check ins, medication adherence prompts, post discharge follow ups. At the highest layer, it touches clinical triage and advice, but only under strict constraints. This is where the system must treat safety as the primary design goal. High risk scenarios must trigger escalation to clinicians, especially when uncertainty is high or warning signals appear. A futuristic voice hub does not try to replace clinicians. It expands capacity where humans are scarce and routes appropriately when human judgment is required. This aligns with the economic reality highlighted in digital health research. Healthcare systems cannot economically justify continuous human monitoring for every patient at every moment, even when monitoring would prevent deterioration. Voice based AI agents can fill that preventive gap, especially in the mild to moderate severity zone where early intervention is valuable. Now let us make this real with concrete future workflows. Picture a patient calling with a simple need. I need to reschedule my appointment next week. The Voice Hub confirms identity, checks provider availability, reschedules, sends confirmation by text, and updates the scheduling system. Now picture a patient calling with uncertainty. I have shortness of breath and chest tightness. The Voice Hub immediately switches into high risk triage mode. It asks a minimal set of safety questions, detects urgency indicators, and escalates to a clinician or emergency pathway based on policy. The key is that escalation is not a failure. Escalation is the design. Now picture chronic care. The Voice Hub calls a patient with heart failure every morning for a 2-minute check in, weight changes, swelling, fatigue, medication adherence. It detects trend shifts and alerts the care team before the patient decompensates. Now picture population outreach. The Voice Hub conducts multilingual screening outreach tailored to health literacy and tracks engagement. This is particularly powerful for underserved populations when designed thoughtfully. Healthcare voice agent literature describes how such agents can support proactive, personalized outreach at scale, including prevention engagement. Now picture clinician documentation. Instead of typing, clinicians speak. The system captures the encounter, generates structured notes, and prepares documentation for review and sign off. We already see early versions of this in real deployments. A mobile voice-based AI system for healthcare in low-resource environments demonstrated how speech input and LLM processing can generate structured EMRs and flag clinical risks in real time, including multilingual usage aligned to local workflows. That is a preview of what the Voice Hub becomes when it is integrated end-to-end with care delivery. Now let us talk about what makes it futuristic, not just functional. First, real-time orchestration across departments. The Voice Hub does not just answer questions, it completes tasks. It triggers workflows, it opens tickets, it schedules labs, It routes referrals. It requests prior authorizations when possible. It coordinates transportation. It becomes a workflow conductor. Second, continuous safety intelligence. The Voice Hub uses structured risk tiering. Low-risk tasks are automated. Moderate risk tasks are monitored with guardrails. High-risk tasks are escalated with audit trails and uncertainty logging. Third, accessibility and equity by design. Voice is a universal interface. It reduces reliance on apps. It helps patients who struggle with forms. It enables multilingual support, and it can adapt language and pace to the individual. Fourth, operational intelligence. Every call becomes analytics. The system identifies the top reasons for calls, where patients get stuck, where misinformation appears, where staff workloads peak, and where processes fail. That becomes a feedback loop for improving operations and patient experience. Fifth, low latency, human-like pacing. The future standard is conversational speed and timing that feels natural. Research in end-to-end voice pipelines emphasizes that naive sequential chains create cumulative delays and that concurrency and streaming are required to reach real-time responsiveness. Now let us address the hardest part. A voice hub cannot be owned by one team. It requires a platform operating model. You need a centralized voice AI platform group that sets architecture standards, safety rules, and governance controls. You need clinical leadership to define risk pathways, escalation thresholds, and acceptable use cases. You need security and compliance embedded from day one. You need a continuous improvement engine that retrains domain language models, updates approved knowledge, monitors latency and accuracy, and measures patient outcomes. This is how the Voice Hub becomes durable infrastructure, not a pilot. Now let us close with the long-term future. Over the next decade, the Voice Hub evolves into a real-time clinical command center. It becomes multimodal, connecting voice with text, patient portal messaging, and video visits. It becomes proactive, calling patients before they call you. It becomes personalized, remembering preferences, language style, and care context within strict privacy rules. It becomes predictive, detecting deterioration signals early and routing care team attention where it matters most. It becomes a bridge across the healthcare value chain, connecting payer, provider, pharmacy, labs, and care navigation into a single conversational workflow layer. The future hospital will not just have an app, it will have a voice operating system. And the organizations that build this platform now, with safety, governance, and scalability at the core, will expand access, reduce administrative friction, and create a more resilient model of care delivery. That is the futuristic voice hub for healthcare. Thank you for watching.